Hello and welcome to Good Life, the health show with me, Pooja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, cirrhosis is a late-stage result of liver disease and its complications. You may not have symptoms in the beginning stages of the disease. Common causes include alcohol use disorder, hepatitis and non-alcohol related fatty liver disease. Now, treatment depends on the cause of cirrhosis and how much damage exists. Liver transplantation may be an option if your liver is failing. So, to discuss on the topic, we have with us today Dr. Pankaj Bharali, consultant medical gastroenterologist from Health City Hospital. Well, thank you so much, Doctor, for joining to Good Life, the health show. So, liver cirrhosis or cirrhosis in liver, we are taking this topic because this is also a very common topic which is being seen or which is being heard nowadays. Now, if we talk about what is liver cirrhosis, what would you like to say?
So, basically, liver cirrhosis is the result of end-stage liver disease. Cirrhosis, in simple language, we mean there is scarring of the liver. The liver gets scarred.
Okay.
Normal liver, it is soft and its surface is very smooth. When cirrhosis sets in, the liver shrinks in size. It becomes small and the surface becomes irregular. At this stage, we say that liver has become cirrhotic.
Now, why knowing liver cirrhosis is important, Doctor?
See, knowing liver cirrhosis is important because of two major things. First of all, among the solid organs in our body, liver is the largest one and it has numerous functions. First, from producing your bile acids, proteins like albumin, cholesterol, in removing toxins from your body, in resisting infections, in storing your vitamins and minerals.
Okay.
There are a lot of functions that liver does. So, if your liver function is hampered, all of these things are going to be hampered. Secondly, liver-related death is now increasing day by day. So, the latest data what we have of 2016, it shows that around 2 million deaths globally, almost 18% deaths were due to the cirrhosis and chronic liver disease. So, I think it's pretty much very big burden on our health system.
Okay. Now, if we want to know about the basic causes for liver cirrhosis, what would be that?
As you have already mentioned, number one cause is the alcohol intake. Alcohol intake in any form of alcohol, not just whatever you say, any type of alcohol, whether it's your beer or wine or whiskey or whatever it is, the local made, any type of alcohol, if it is taken for a prolonged period of time, definitely is the number one cause in our country. Still, it is the number one cause. Secondly, you have rightly mentioned about the chronic hepatitis, like hepatitis B and hepatitis C. Thirdly, the most upcoming cause in the Western countries is this fatty liver disease. And being India as a diabetic capital, I am sure that fatty liver disease as a cause of cirrhosis, it will soon come to number one. Apart from these three common causes, there are a few other causes like certain drugs. Certain drugs which we give for treatment of other ailments, it can damage to the liver. Next, there are few young women who present with cirrhosis. Those women, when we evaluate, we found that they are having autoimmune liver disease. Autoimmune liver disease means your body is hampering your own liver. So, these are the few young women who present with cirrhosis. In few young children who are genetically predisposed, we find diseases like as Wilson disease. Wilson disease is where your liver can't detoxify the copper. The copper gets deposited in the liver and the child presents with the cirrhosis. There are multiple other metabolic and hereditary causes, but for us, for today's discussion, alcohol, fatty liver disease and hepatitis and autoimmune liver disease, these are the important causes for cirrhosis.
Okay, important causes for cirrhosis. Of course, our numbers are flashed on your television screens, viewers. So if you have any queries regarding the topic which we are discussing at this point in time, please call up and ask your questions. And Doctor is with us at this point in time. He will give you all the answers. Now, Doctor, coming back to you again. Now, there must be some symptoms that a person will come to know that they are having a problem with the liver. So what are those symptoms? What are those basic symptoms?
At the very beginning, the patient will not have any symptom, which you say medically as patient is asymptomatic.
Asymptomatic.
When the patient starts having symptoms, his symptoms are pretty much vague. They are non-specific. Like patient will complain of fatigue, lethargy, weakness, loss of appetite, nausea, something like that. When this liver disease again progresses, other symptoms develop, like the fluid will build up in his legs, which you say as edema, in his stomach, which is abdomen, which you say as ascites. Patient might get jaundice. Patient can also come with history of blood vomiting, which you say is hematemesis, or black stool, which you say as melena.
Okay.
So these are the common presentations. Secondly, As I've already mentioned, that liver is an important organ as it removes toxins like ammonia. If the liver fails, if it is not removing these toxins get deposited in the brain. At that point of time, the patient will present with brain symptoms like he might be confused, he is not talking properly, his behavior is erratic. So we say this as hepatic encephalopathy. So this patient presents with brain symptoms. Another thing is that when your liver gets infected, your kidney becomes weak.
Okay.
So with cirrhosis, the kidney problem always starts. Sooner or later, you will have kidney problem also.
Okay. So if at all any symptoms arises in a patient or in a person, so what is the first thing? To immediately go and see a hospital? And at what time, like if we talk about the investigations now, usually what are being done if a person comes to the hospital?
See, if a person comes with these findings, like he is coming with jaundice, he has history of bleeding from mouth or from stool, or he has in altered sensorium, talking incoherent. If this patient presents with us with the background history of such as diabetes or background history of taking significant amount of alcohol, then we empirically think that this patient might have cirrhosis. So we move in that direction. Basic test which we do is one year normal routine blood test to see if its hemoglobin is decreased or not, to see the platelet count. As the cirrhosis progress, the platelet count decreases. So this gives an indication. We then look for the liver function test. We see the AST-ALT ratio. In cirrhosis, the AST-ALT ratio is more. Then we go for in the other part of the liver function test like bilirubin. If the patient is having jaundice, the bilirubin will shoot up. Then one important function of the liver is clotting. When we get injured or blood comes out, our blood clots. That clotting is done by few proteins, and those proteins are made by the liver. So if liver is damaged, your clotting is going to be hampered. So this is reflected in your PTINR value, which we say this coagulation profile.
Okay.
Next, the most basic investigation is your ultrasound. So what ultrasound will show? Ultrasound will show that your liver has shrunken in size. It is not normal in size, it is shrunken, and it has a coarse ecotexture, means it is not smooth, it is irregular. So this is the first indication, yes, your patient might be having cirrhosis.
All right, doctor, we have a caller. Let's take the call first. Hello.
Hello. Hello, মই গুৱাহাটীৰ পৰা কৰিছিলোঁ. Actually, I'm a working woman. For that, মোৰ খোৱাবোৰ টাইম টেবল মতে নহয়, আৰু সেইটো কাৰণে ইভিনিং কিবা এটা খাই দিলেই মানে অলপ গেছৰ নিচিনা প্ৰব্লেম হয়, সেইটো কাৰণে লিভাৰত কিবা এফেক্ট হ'ব নেকি?
Okay. Erratic lifestyle.
So what you are talking is about your
অসমীয়াতে ক'ব পাৰে।
আচ্ছা, আপোনাৰ খোৱা বোৱা যোনটো অসুবিধাটো ক'লে চাগে আপোনাৰ কামাই কাজৰ কাৰণে সেইটো আপোনাৰ খোৱাটো ঠিককৈ হোৱা নাই, তো সেইটোৰ কাৰণে আপোনাৰ ডাইৰেক্টলি লিভাৰৰ প্ৰব্লেম নহয়, কিন্তু আপুনি যদি ৰেগুলাৰ আপোনাৰ ডায়েটটো মিছ কৰিছে, তাৰ সলনি যদি আপুনি বেলেগ কিবা ফাষ্টফুড জাতীয় তেনেকুৱা বেছি বস্তু খাইছে, চাইনিজ ফুড আইটেম সেনেকুৱা বেছি লৈছে, সেইটো বস্তু গৈ পিছত আপোনাৰ ফেটি লিভাৰ কৰিব পাৰে, এণ্ড ইন দ্য লং ৰান সেই ফেটি লিভাৰটো আপোনাৰ লিভাৰৰ প্ৰব্লেম কৰিব পাৰে। ডাইৰেক্টলি নহয়, বাট ইনডাইৰেক্টলি ডিপেণ্ডিং আপন ইয়ৰ ডায়েট, আপুনি কি খাই আছে সেইটো ডেফিনেটলি ডিপেণ্ড কৰিব।
All right. So this must be a very common questions from each and every person because of the lifestyle which everybody is leading. Not a proper food timing is there. Not a proper food intake is there. So on that note, what would you like to tell, doctor, to the viewers who are watching our show?
See, if we speak strictly regarding in case of cirrhosis, if we speak in terms of cirrhosis, as such, there is no restriction of food item.
Okay.
Okay, you can't restrict everything. So there are limited few things that we should take care of, that depending upon how the patient presents with you. If the patient has come to you with swollen legs, with water in his abdomen, which we say ascites, yes, there are few things which you should do, which you should mention in the diet, like your salt intake should be reduced. Salt intake, we advise that when the patient comes with ascites or edema, we say that the patient should take at least 1 teaspoon of salt throughout the 24 hours.
Okay.
This is the basic recommendation every gastroenterologist or hepatologist will give you.
All right. So this is one kind of tip which you can
but
say.
the problem is that most of the patients come and they will tell, sir, ami nimok bondho kori disu. But this should not be done.
Okay.
Because if you stop salt,
Taking salt.
so that diet becomes unpalatable.
Okay.
So he will definitely decrease the intake of his diet, and that is going to hamper his lifestyle.
All right, doctor, we have another caller. Hello.
Hello. Hello.
Hello. আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব।
Hi. I just wanted to know, for severe gastric patients, what kind of breakfast is recommended? Because breakfast is very important meal, but if we take roti sometimes on puri, then we have gastric problems. So what kind of breakfast is recommended for severe gastric patients?
All right, so breakfast tips.
See, regarding the breakfast, yes, definitely it is a very important, our first meal is a very important for all of us. Now, regarding your whatever breakfast you are taking, suppose you are taking roti and someone is not taking roti, he is taking some oats or rice products, something like that. You can't strictly classify that, yes, you should take roti or you should take rice, because some of the people, they will have complaint after taking roti. They will complain of indigestion, bloating and everything like that. But not every people will complain of indigestion. So, this is nothing like this proper what you would have. You can have everything that doesn't causes you this stomach troubles like dyspepsia and all this indigestion. So, what I basically recommend is, whatever you have in your home, whatever you daily is your daily intake, you first try all of these things, whatever you take regularly. You first make out the list, what is causing you the problems. If you find those food items, yes, these are causing me my problems, definitely first thing is that you have to decrease the proportion of these food items. Even after decreasing the proportion, if you see, yes, I am good, I am doing good, my digestion problem, indigestion problem is not there, then you continue with that low proportion of the food. But even if you see that after decreasing the proportion of the food also, you are not able to take it properly, you are having indigestion issue, then I recommend you, yes, you might leave that diet. So, this is how you should categorize your diet.
All right. Thank you so much for calling. All right, Doctor, we'll have more conversation, but we have to take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching Good Life, the health show with me, Pooja, and we are having a fruitful discussion on the topic liver cirrhosis. Now, doctor, coming back to you again. Earlier to the break, we had an idea about the investigations, what are being done to a patient. Now, after the investigations are being done, will the treatment start at the earliest, or depends on the stage of the person as well?
See, it mainly depends on the stage at which the patient presents. If we say in simple terms, the cirrhosis patient, we can divide into two categories.
Okay.
One is compensated and one is decompensated. Compensated is one when patient doesn't have any symptoms. And we got to know about this cirrhosis while we are doing investigation from some other disease. Suppose we are doing ultrasound for some other disease, then we find, yes, liver is being cirrhotic, he has cirrhotic changes, then we say this patient has compensated liver disease. These patients do not present with liver specific syndromes.
Okay.
Secondly, when these patients progress and they decompensate, they usually present with those symptoms which I had already discussed, like jaundice, swelling of the feet, ascites, irrelevant talk, irrelevant behavior, bleeding and all. So, when these patients present with these complications, yes, definitely we have to start treatment on those patients.
All right. Now, how to manage the symptoms of liver cirrhosis? Already, we'll talk on that, but we have a caller. Let's take the call. Hello.
Hello.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
হয় হয় মোৰ মানে কি মেডিচিন খোৱাৰ পিছত বিশেষকৈ গেছৰ মেডিচিন খোৱাৰ পিছত মোৰ লিভাৰ চাইডত অলপ পেইন কৰে আৰু পেইন কৰাৰ পিছত অলপ ভমিটিং নিচিনা ফিল এটা হয় আৰু প্ৰায় মানে ভোকটো নলগা নিচিনাই হৈ যায় এইটো গেছৰ টেবলেটটো খোৱাৰ কাৰণে এফেক্ট হয় লিভাৰত আৰু সেইটো কাৰণে কি এনেকুৱা লিভাৰটো মোৰ বেয়াকৈ গুচি যাব পাৰে নেকি
আপোনাৰ যোনটো প্ৰব্লেম আছে পেইনটো বুকুৰ তলত ঠিক তলত হোৱা বা সো সাইডে হোৱা সেইটো ইউজুৱেলি লিভাৰ ৰিলেটেড নহয় তিনটা বস্তু বহুত কমনলি আমি পাওঁ মানে সেইটো ঠাইত যদি আপোনাৰ প্ৰব্লেম হয় বেসিক্যালি কমন ল্যাঙ্গুৱেজত আমি যোনটো গেছৰ প্ৰব্লেম গেষ্ট্ৰিকৰ প্ৰব্লেম বুলি কওঁ সেইটো এটা থাকে কিছুমানৰ আপোনাৰ গলব্লাডাৰ ৰিলেটেড প্ৰব্লেম থাকে কিবা গলষ্টোন হ'ল গলব্লাডাৰ পাথৰ হ'ল সেইবোৰ পেশেণ্টৰো কেতিয়াবা থাকে আৰু থাৰ্ড কেতিয়াবা পেনকেজৰ যদি কিবা ইস্যু থাকে তেতিয়া আমি সেইটো তিনটা কমন কজ হয় যাৰ কাৰণে আমি তাতে সেই এৰিয়াটোত পেইন পাওঁ মানে লিভাৰৰ কাৰণে পেইনটো আপোনাৰ অনবৰত তেনেকৈ নহয় যদি আপোনাৰ লিভাৰটো বহুত ডাঙৰ হৈ গৈছে সাইজত ষ্ট্ৰেচিং হৈ গৈছে তেতিয়া আপুনি মিহি এটা বিষ ফিল কৰিব কিন্তু দৰবৰ কাৰণে সেইটো বিষ নহয় কেতিয়াও
All right. Thank you so much for calling. Now, doctor, if we talk about the stages of liver cirrhosis, so what are those, doctor?
As I have mentioned, if we broadly classify, it's decompensated and compensated.
Okay.
So, in technical terms, medical terms, if I say stages of cirrhosis, we can classify this again as 4 stages. In stage 1, patient will not have ascites or edema, something like that, and he will not have varices. Varices means when the liver becomes cirrhotic, the pressure inside the liver increases. The normal blood flow in the liver, it is hampered. So what happens, the pressure is developed. This pressure, it is reflected. And why it is reflected? It is reflected in your food pipe. So the blood vessels in the food pipe, which we say as esophagus, these blood veins in the blood esophagus, they get dilated, which we say as varix. And this varix rupture and the patient's presents with bleeding.
Okay.
So in stage 1, patient will not have this varices or this ascites. In stage 2, patient may present with varices but not ascites. Stage 3, patient can have both ascites and varices, and stage 4, patient will have ascites also, and that patient will present with bleeding also. So
All
these
right.
are the 4 stages.
4 stages. Now, which is the most complicated stage, doctor, to attend a patient?
See, when we say decompensated liver disease, the most common type of decompensation is ascites, the fluid collection inside our abdominal wall.
Okay.
So this is the most common presentation. 60% of patient will present with this type of complication. And when this ascites progresses, when the duration progresses, when the disease progresses, there are certain complications associated with ascites. That we say the fluid itself can become infectious. This is one of the complication. Second, due to this ascites, your kidney can get damaged, which you say is AKI, acute kidney injury, or HRS. Second is that thing. And third is the thing, the ascitic fluid, that it can go up to your chest also, chest wall also. That we say is hydrothorax, hepatic hydrothorax. So these are the complications associated with ascites. Second part is that which is difficult to control. Yes, ascites, when it becomes refractory, that is, it is not controlled with medicine, it is definitely difficult to control. And what we fear most is the bleeding.
Okay.
So when the patient presents with variceal bleeding, it's a patient loses a huge amount of blood. So this is what we fear most. When patient have those symptoms of blood vomiting or black stool, he should immediately land up to the hospital. If it is possible, patient is stable, then we take the patient to the endoscopy room. We look for the patient. If possible, we put bands. We say this variceal bands. This is like the rubber band we put inside the patient's neck and tie up there to block those varices to prevent the bleeding.
Okay, okay. Now, when is the patient being referred for a liver transplantation, doctor? Is that for an extreme case?
Yeah, see, liver transplant is indicated when the patient gets decompensated. All those symptoms, jaundice, kidney failure, ascites, talking incoherently, he is having hepatic encephalopathy, irregular behavior, all those things are the indications for liver transplant.
Okay.
So why liver transplant? Because once patient starts having decompensation, his lifespan decreases pretty very much. Median lifespan is around 2 years only. So once this patient have this type of complication, we said we always ask the patient for, if it is financially they are stable enough, we always ask the patient to go for liver transplantation.
Okay.
So once patient is decompensated, he is the candidate for liver transplantation.
Okay. Now, if the liver is transplanted, so what are the chances, doctor? Like, what are the do's and don'ts of the patient? Of course, you give a recommendation or like a proper do's and don'ts to the patient and as well as to the attendants as well. So, does the patient live a normal life?
Yeah, pretty much a normal life. See, why liver transplantation is important. When we say the benefits of liver transplantation, we say in terms of mortality benefit. Liver transplantation patients, once it is transplanted successfully, 1 year survival rate is around 85 to 90%.
Okay.
And 5 year survival chances is around 70%. Second thing is that after this thing survival chance, his quality of life also improves. For these reasons, we recommend the patient, if it is financially he is stable enough, to go and have your liver transplant.
Of course, a question arises whenever we talk about liver transplantation on the financial crisis as well, because it all depends on the patient or the attendant's financial health. So on that note, doctors, of course, there are a lot of schemes which are available nowadays, the government schemes. But on that note, do you recommend patients to have a liver transplant here itself, or they have to see a doctor outside?
So liver transplantation, as far as my knowledge goes, it was initially done in, I think, Downtown Hospital, 1 or 2 cases were done. After that, there was, we don't have any liver transplantation case now. But yes, patients from Assam are going outside and doing the liver transplantation. So the thing is that the cost of transplantation, it varies according to the institute. So approximately, if you get a live donor, your family members, blood relatives, if the blood group is matching, if they donate, so somewhere the package is around 25 lakhs, 20 to 25 lakhs. And if you go for a cadaver, means a dead body donor, then it increases to around 27 to 29 lakhs. And the whole package is for around 3 weeks to 4 weeks, means 1 month, roughly 1 month.
Okay.
This is the whole package.
So what are the things that one has to make a note of it if they want a donor? So what are the things that donor has to understand and the patient has to understand before donating the liver?
See, liver transplant is not like any normal surgery. You go like, you're having gallstone, you are going to the hospital, it's getting removed. It is not like that.
Absolutely.
They were having a full team, entire team.
There is a formality as well, I guess.
There is a formality, especially for this cadaver donor. You have to get registered also. You have to take state clearance also, then you have to get registered. So after the team sets, and they will decide whether this patient is eligible as a donor, the attendant is eligible as a donor or not.
Okay.
After doing the all necessary investigations, what is required for liver transplantation, only then they will put the donor for transplant.
Okay, okay. So these are the things. Now, how important is to counsel the attendants of the patients who come to you because of this liver transplant or the treatment of starting for any kind of stages? So is it important to counsel these patients? Because whenever you start the treatment, if the treatment stops in between and they don't come and see the hospital again, so on that note, how do you counsel the patients?
See, liver transplantation till now in our setup, particularly speaking of Assam, it's not feasible for everyone.
Okay.
So the main thing is that medical therapy, which we are doing. So those patients, we regularly ask them to come to the hospital for follow-up. Every 3 months or 6 months, they should come and visit for the follow-up to look for what is the stage of the cirrhosis, whether it has progressed or the patient has developed some new complications. We have to look for that thing. And one of the major complications of liver cirrhosis is development of the liver cancer, which is we basically ignore, but a patient, once he has developed cirrhosis, there is a 4% chance every year that he can develop liver cancer also. For this reason also, he has to regularly come to the hospital for follow-up.
Okay. So how long does this session take place when they come regularly to hospitals?
See, session takes place because...
Depending on the patient?
Yeah. Now, one thing you have to understand, we all have to understand is, cirrhosis is not curable.
Okay.
One treatment for cirrhosis, one definite treatment is liver transplantation. If we take liver transplantation out of context, the next thing is the medical therapy. As long as the patient is feasible enough to come to the hospital and get checkup, it has to be continued throughout his life.
All right, doctor, we are short of time. So a proper message and what kind of tips or what kind of do's and don'ts you would like to tell the viewers who are watching our show?
See, majority of the cases of liver cirrhosis in our country is still due to the alcohol. So my sincere request to everybody will be, leave alcohol as much as early as possible. Second main issue in our country is herbal medications.
Okay.
When a patient having jaundice and something like that, they will went to the local physicians or like that. They will give some herbs and all, and that causes the biggest damage to the liver. Whatever chances of coping up with the liver disease is present, it gets destroyed. And this is the major burden of our country. Not only in Assam, I have seen in other states also, this is the same story. So decrease your alcohol intake, don't go for this quacks and all things. And if you are having the specific disease like hepatitis B, C, autoimmune hepatitis, there are definite treatment for that. You take the treatment, stay in regular checkup. This might keep you healthy as far as possible.
Okay. Do your patients listen to you when you give them these tips?
Regarding this, alcohol is very hard.
Very
it's
tough
very
for
hard,
them.
very tough. The main sufferers are if the patient is a male, the main sufferer is the wife. The wife and the children, they suffer a lot because of the patient, because they have to repeatedly come. And this becomes an emotional burden, there is a financial burden which they have to carry lifelong.
All right. Thank you, doctor, for joining today and giving us those wonderful message and those valuable information at this point in time. Thank you so much for calling me to Good Life, the Health Show. All right. With this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. In our next episode, we will be discussing on some other important health issues. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.